In Tower Hamlets, we really are pushing for HIAs to not just mitigate the negative impacts or negative health impacts of a development, but demonstrate and make recommendations around how a scheme can enhance health and reduce health inequality. So my role is embedding health within spatial planning, particularly working quite closely with the local plan team. And as an architect, I know how planning works. We produced a new Healthy Communities policy which embeds HIA within the planning process. We looked at issues around HIAs we'd received in the past, so lack of community engagement, not enough representative engagement of particularly vulnerable groups, lack of monitoring of HIAs beyond planning application stage, and we've worked really closely together to embed those elements within an emerging HIA policy and really led on what outcomes we wanted to be demonstrated in the application. So things around equitable, safe environments that took into account the needs of all users, particularly women and girls, minority groups, disabled individuals. In terms of getting an HIA policy right, I think collaboration with planning colleagues is really key. We worked really closely with them to understand what the issues were with the existing HIA policy we had and worked quite closely with them to develop a policy which they were happy to implement. So on a recent planning application, upon review, we saw that the play spaces within the application weren't equitably laid out. We thought that there wasn't enough community engagement, particularly with local children, and we used the HIA to point these things out to the applicant and also to the case officer. The case officer used my comments and really used them to advocate for more community engagement and better play spaces as part of that application. Our guidance is very much aligned with Play England's 10 play principles, one of which is community engagement and co-design with children. Another issue that comes up again and again is offerings for teenagers, particularly teenage girls. So we've done a lot of work in the borough around gender-inclusive design. If we could move a play space away from a busy road to a more sheltered location, I mean, that would mean decades of improved health outcomes for some of the most vulnerable children. Planning is a really long-term project. It's the next 20, 30, 40, 50 years of our built environment, which we need to safeguard. And we don't want to build slums of the future. Once you see diggers in the ground, the outcomes of that scheme are already set, potentially already a decade before that. So yeah, for me, embedding health within planning is crucially important, and we're only at the beginning of that process, and I'm actually quite excited to be part of that.